Welcome back to our discussion on healthcare and the state of health in Union County 2012. I'm going to ask my panelists, starting from left to right, if they would introduce themselves and tell us a little bit about the organization that you're affiliated with.
I'm Cory Storch. I'm the Executive Director of Bridgeway Rehabilitation Services. We're based in Elizabeth. We serve all of Union County. We serve about 1,000 people at any given time in Union County. And we specialize working with people who have serious mental illness. The folks we work with have the most challenges for living in the community, staying out of psychiatric hospitals. A lot of them have co-occurring conditions like substance abuse and various medical conditions. And the lifespan for the people we serve is 25 years less than the general population.
Hello, my name is Paulette Hussey, and I represent Neighborhood Health Services Corporation. And we are a federally qualified health center. We are located in Plainfield, and we have additional sites that are located in Elizabeth. We have one in Sussex County, one in Warren County, and we also have some school-based sites.
Hello, my name is Dara Arias, and I'm the founder and executive director of Cremenos, or for the English-speaking population, Healing Together. Cremenos helps medically underserved and uninsured women affected by breast cancer, and our current focus are primarily Latinas right now due to all the barriers that they face for healthcare.
Thank you.
My name is Jennifer Griola, and I'm the executive director of Susan G. Komen for the Cure, North Jersey. We are located in Summit, New Jersey. However, we serve all 9 counties of northern New Jersey. Our main focus is granting out money to different programs throughout northern New Jersey. We gave out $1.2 million last year in education, treatment support, and screening grants. And for instance, we fund the mammogram van out of UMDNJ, and we fund different hospitals that provide screening mammograms to underinsured and uninsured women and men throughout northern New Jersey. We also send 25% of our funds to the National Research Fund through Komen National, which has committed over $2 billion in the last 30 years to breast cancer research.
Thank you all for being here this morning. It's very timely. We're here in October, and it is Breast Cancer Awareness Month. So let me start with the two of you, and if you could discuss how prevalent breast cancer is, perhaps specifically in Union County, or discuss a little bit the populations that you serve.
You want to start with the populations and,
Sure.
and breast cancer?
Sure. In Union County, you know, in New Jersey in general, 1 in 7 women will get breast cancer in their lifetime, whereas in the United States that number is 1 in 8. So in New Jersey and in Union County, more than ever, breast cancer is important, that we commit the money to research and to supporting programs that do mammograms and education and treatment support. And you know, in Union County, it's vastly different. So you can go from low-income, underinsured, uninsured women to a very wealthy population. So the healthcare needs within Union County are very vast and very different, which is why organizations such as Dara's are so important, because they are reaching right into the heart of many communities that have many barriers to getting the education they need about breast health. And we also have partnerships with organizations such as Sisters Network, who reach out within the African American community. So there's just so many different needs that exist.
Yes. And talk about, the population
Sure.
that you
Yes. I'm Colombian, I'm Latina, and I'm also a breast cancer survivor. And I was very lucky because my cancer was detected at a very early stage. Unfortunately, for the majority of Latinas and also for African American women, they're usually diagnosed at a late stage of the disease when treatment options are more difficult. And also for Latinas as well as for African American women, our tumors tend to be harder to treat compared to white women.
Why is that?
They don't know yet. Mm-hmm. I mean, there's still a lot of research, but a lot of Latinas, especially with the population that I serve, their cancers are very aggressive, the tumors are very aggressive. typically is triple negative, and that type of cancer is very difficult to
And
treat.
harder to treat. Right?
Absolutely, especially when it's at a later stage. Prognosis is very, it's not as great. So going back to my particular diagnosis, I was very lucky that it was detected early on. And it's very difficult when you're diagnosed with breast cancer, even when you speak English, when you have insurance, it is very difficult to navigate the system. And that's the main reason why I established Cremenos, because I know how difficult it is. And based on my work in the community, like I said, our target right now are Latinos because of the additional barriers that they face. The majority are uninsured, they do not speak English, and there's the cultural barriers. And living in the country without the support structures, it makes it more difficult to overcome a breast cancer diagnosis.
And you deal with documented and undocumented populations.
Absolutely. We don't ask their status because that's not really what we do. We're there to help the patient. But I know that in New Jersey, the Latino community is the largest minority group right now, and it's the state with the highest documented, the 5th state in the country with the highest number of undocumented individuals. So it creates a problem too, because for women that are undocumented, they're afraid to seek treatment.
Right, right. So they may delay it.
Oh, absolutely.
To do that.
Absolutely.
Now, Paulette, the population that you deal with obviously has access issues, primarily financial. Or what other barriers do you find that you face?
Well, our main population, the clients that come to our center as a federally qualified health center, or we serve the undocumented, we serve the underserved, the underinsured, the uninsured, and you can also come to us whether you have insurance. You know, if you do have insurance, like my doctor is there, that's where I go, and I have insurance. So it's not just the uninsured or the underinsured that we serve, or the undocumented. We serve everyone.
And what are the primary medical issues that you deal with?
Oh my goodness. Well, at our health centers, we have adult medicine. You know, our departments, you know, that we service adult medicine. We have an OBGYN care. We have dental. We have pediatrics, huge pediatric department. We have optical. We have podiatry. You know,
And are there specific disease states that you find are more common, perhaps, in your populations or in Union County?
Disease states, diabetes is very huge. Also, we have the high blood pressure. We also have a very large HIV population that do come to our center.
And Cory, you mentioned a lot of comorbidities. What are some of the medical conditions as well as the behavioral health issues that your clients deal with?
Well, on the psychiatric illness side, a lot of the folks that we serve have schizophrenia, bipolar disorder. We see a good deal of severe depression. I think that's fairly common. Depression, you know, is really a very common problem across the whole community. As far as co-occurring problems, we do see a good deal of diabetes. We see hypertension, heart disease. We do see some cancer as well. And the folks that we serve, there are significant barriers to treatment. You know, certainly a lot of the folks we work with have Medicaid or no insurance, so they have a hard time getting access because the Medicaid rates for primary care providers are very low. We depend on the Federally Qualified Health Center, Neighborhood Health Services Corporation, as a referral source to provide that kind of treatment, the primary care doctors and nurses to help our folks with those problems.
Now, one of the questions we usually ask as we move around and do these series when we get to the healthcare panel is, how do you think the safety net is working in your county? You all are the safety net.
Right.
And,
Yes, we
and
are.
you deal probably extensively with FQHCs and low-income providers, or you're that provider. What are you seeing these days in terms of how well you're able to meet the needs of your communities?
Well, I think that there is a fairly strong safety net in Union County, and I think a lot of it comes from government support to a large degree. The federal program is Social Security. They have a supplemental income program. If you have a disability, you can get that. And probably to the point of this discussion, it comes with Medicaid. So a lot of people who are in need and have very low income can benefit if they have a disability.
Paulette?
Well, as we were mentioning before, as far as, say, the undocumented, most of that population do not have Medicaid. So they do come to us, and we do uncompensated care, where we do have a sliding scale for them. So they're not turned away. When they walk into our center, they're going to be seen. Whether or not they have the full amount to pay, if they do not, we work out with them individually what they are afford, they can afford to pay. And then we deal with, we have a large Medicaid population, the large Medicare combination. So we really cover the gambit.
And now, Jennifer, obviously, breast cancer doesn't have economic barriers. It goes wherever. So what do you find? The people who come to you, are most of them insured?
No. In fact, if someone just calls the office, it could be anyone. But most of the women that we interact with tend to be uninsured or underinsured. And so when somebody needs to get screened, they'll go to a center and they will qualify either for Medicaid, or they will qualify for something called the SEED program, which is the Cancer Early Detection and Education Program. However, SEED only has enough funding to actually fund 10% of all of those who would actually qualify for that program. So there's always a gap of how many screening mammograms can be done through the SEED program, which is where Komen would then come in, and we provide mammograms as well. But there are definitely gaps in services that exist. And then should somebody unfortunately have something detected in a mammogram and then need to go on to get farther testing done, there's a whole other series of programs that exist to help somebody to afford that. And so even before the mammogram takes place, they look to see where somebody would qualify, whether that be charity care at a hospital or the Medicaid program or additional SEED funds. But there are gaps that exist, and it's important that we address those.
Yes, there are gaps and there are disparities, especially when it comes to the to the poor, and this goes across all races. For Latinos, what's unfortunate is the language barrier, and that's why having an advocate on their side is so important, because they need someone that will help them navigate the system, navigate the process, because it's very complicated.
We heard a lot yesterday, we were in Hudson County yesterday, about the need for navigators in the system. Do you have those anywhere?
We do. We fund breast health navigators at a number of different centers throughout northern New Jersey. You in fact, do some breast health navigation for patients as well.
Yes, there's two types of navigators. There's the ones that exist in the system, and the majority of the hospitals now have navigators. Sometimes they even have two navigators. They have the breast navigator and the nurse navigator. But those are all specific to the hospital. What there's a huge need, and that's what Cremenos does right now, is that we have navigators in the community. And yes, there are safety nets. There are all these services available, but if they're not culturally competent or in their own language, a lot of people are missing out on all those resources. I mean, the SEED program has been around for a very long time. Still, many women do not know about it.
It's an awareness issue.
Exactly.
Your outreach, how do you outreach to patients? Did you want to say something? I'm sorry.
I wanted to just respond to, about the health navigators. We're seeing more and more in behavioral health that this is happening. And it's necessary. We're starting to, we have service teams, and we start to add nurses to, not psychiatric nurses, we already have those, but wellness nurses who are dealing with the whole gamut of illnesses. And we're starting to use peers. These are people with lived experience of mental illness. And we're training them as wellness coaches.
Are these volunteers, or they're
No, these are paid staff. We're adding them to our team so they can speak to people, from experience about mental illness, but they could also talk about the co-occurring problems. And this notion of health literacy is becoming more important at Bridgeway, and I think other places, because a lot of people don't really understand their health problems and their treatment. And the doctors have very little time to talk. I mean, the business model for primary care is, you know, you see the person really quickly and then you pass them on to other staff. But the doctors and the advanced practice nurses have very little time to talk to people, to help them understand their health issues and their treatment.
Well, often doctors don't know they don't know the whole patient either. So
That's right.
One of your patients may go in for a physical condition, and well, it may be complicated by, or the behavioral health, the mental health condition may exacerbate it, or without knowing that whole thing, how to treat that whole person.
And we see people that they're getting prescribed medications by our psychiatrist, and then we don't even know, and the psychiatrist doesn't even know they're seeing another doctor for a completely different problem. So now they're taking 4 or 5 different medications from one doctor and then 3 or 4 from the other doctor, and there's no coordination. So this navigation notion is really important to make care.
You know, one of the concepts of the Affordable Care Act was the patient-centered medical home.
Correct.
Are you a
Yes, we
PCMH?
have. We have started that in, I think, 3 of our sites so far. It's
And
up
could
and
you explain
running.
briefly what that is and the difference that you see that makes, if it makes a difference?
I'm so sorry that my CEO is not here, because she is more.
She's on jury duty. We should
Yeah,
point out.
she-
Yes, she's
Yes, because she would be the person to really get into it. But I'll let you know what I know of it. What it is that when that patient come into our facility, that patient, we're trying to have a completely well-rounded information as far as that patient is concerned. So that's why we have contacts, we have collaborators, we have we know that patient's whole history basically. So when that patient walks in and the doctor looks at that chart, then all the information on that patient should be there.
Should be there.
Yes.
And do you use electronic health records?
We're into electronic health records right now. We're getting into that funding. That's where funding comes in, and was very helpful to us because it really allowed us to have some equipment, new equipment, beds and electronic health records and so forth.
And do you think this is a positive experience for the patient?
Absolutely, without a doubt. And the fact that we have a multicultural all our employees, we have a multicultural facility where everyone in there, because when the patients come in, they like to see someone like themselves, and they like to talk to someone like themselves. Because if they walk in and they don't see someone who represents them, then it's very difficult for them. So when they walk in, someone speaks their language, so they know exactly that someone understands them, and that care. That feeling of being belonging,
Yes.
In a sense, is there. So we try to put that forth when anyone walks into our building, and to see our docs or to see our staff. We walk around, we say hello to people, we make everyone feel comfortable. When they go in to see the doctor, they know that they're going to be taken well care of,
So all of that is part of the Affordable Care Act, and sometimes we have to maybe remind ourselves that we do have the Affordable Care Act that's passed, that's been upheld by the Supreme Court. Do you think it's made a difference for the people that you see?
Well, it won't be fully implemented until 2014, and some of the questions that we have that haven't been fully answered, we do know that women 40 and above will be allowed to have a mammogram every year. But questions that exist are, what about those women who have a strong family history that are not yet 40? Will those mammograms be covered? What about women who are under 40 who need follow-up care? What about women who find a lump in their breast in their early 20s? That hasn't been fully addressed yet, and so we do have some questions. We think, from a Komen national perspective, that the Affordable Care Act is fabulous because it allows more access to care, and that's what we're all about. We want to eliminate barriers to health care, and especially breast care.
And what about the people that you see? Any impact that you've noticed?
No, the majority of the patients that we served are uninsured, and they usually for either Medicaid or the charity care process. One thing important to note out is that it does not cover undocumented individuals. So what's going to happen? And what's going to happen to hospitals? Are they still going to get the same charity care dollars to take care of that population. So that's on, you know.
Well, of course, in New Jersey, you know, we have the charity care law that hospitals don't get the dollars now. They provide a lot of uncompensated charity care. Funding is just a critical issue for, as we've seen today, in you know, government, in education. How seriously are your services impacted, or does funding, you look to a lot of private funding as well, you do a lot of fundraising efforts, the programs, the Race for the Cure, those things. What's your funding mix, funding ratio?
In terms of what we fund?
Public-private partnership for funding. How much comes from donations? How much is provided by the government?
All of our funding comes from private donations. So it's our fundraising exists through our Race for the Cure, through individuals and communities who come to us and say, we want to have a bake sale, or we want to have our swim team is going to do a race and we're going to raise money, or we have a gala. You know, we have different types of events like that, but they are all private fundraising that we do.
And your organization as well?
Well, let me explain. Cremenos, it's only 3 years old. So basically we're a startup, a nonprofit organization, and typically foundations and organizations are not willing to fund something that's starting up. They want to see results. So funding has been very difficult. We are small, but we have a very structured model. We cover, you know, peer support. Like you mentioned, it's so important for a patient to have someone, you know, that has gone through the same experience. We provide patient navigation services in the community, and that's what's lacking. Like I said, there's a lot of services, a lot of resources. There is a, you know, a funding net, but if people don't know how the process works or where to go, it becomes meaningless in a way. So that's why having a patient navigator in the community is so important, to bring the women into the hospitals. And what we do is we collaborate with the navigators at the hospital. So we don't duplicate services, we complement. And when there's needed interpretation, majority of the hospitals in New Jersey are not required to have interpreters. All interpretation is done over the phone. And I could tell you, as a breast cancer survivor, it is hard to get those news, you know, face to face. So imagine how it is over the phone. It is just too difficult. So that's another service that we provide, that Cremenos is so unique. We provide interpretation services. We're patient-centered. So like I said, we're a startup. It's been 3 years, but we've made a lot of progress this year. I've become very, you know, advocating and bringing up the issues up into the storefront because people are not aware.
Right. The whole issue of awareness and education, how do you begin to make a dent in, not just with your patients, but with the larger population, about the importance of appropriate medical care, the impact that we all, on the economy, for all of us who are paying for people who don't have adequate medical care? You guys have big tasks.
Yes, we do, and that's where our patient outreach services come in very handy. So we go out into the community, we educate, and the whole thing is education is key. And one of the things that you have, say, young people feel like they don't need to have health insurance because they're healthy. You know, so you have to have another young person talk to that young person.
Well, now with the provision that you have health insurance till 26, do many of these people have parents who are insured, or their parents are uninsured as well?
No, some parents are insured. You know, and the ones who do keep their children on until till that age. But for the ones who are working, young people who are working and feel like they do not need the insurance,
if they have an option.
Right, if they have that option, we find that by going out and just keep talking, educating, and like you were saying, that we're in this community in Union County for over 40-odd years. And there's still people who do not know that we exist. You see, one of the issues is that the populations keep changing. You know, so people keep coming in and people keeps going. So the ones who come in, you would think, okay, now they know about us, they know that we're here. But then before you know it, you know, others are gone, and then new ones are coming in. So that's why we have to be very, very consistently out there to educate, and that's marketing. That's information, but that also costs money too. You know, so.
And Cory, obviously you've got educating the patients, but the huge stigma that comes along with behavioral health issues as a barrier that you must overcome too.
Yeah, I think the stigma is the biggest barrier for treatment and help. And when people, you know, don't feel ashamed and they feel comfortable enough to, you know, to say, I think I have a problem, I think, you know, I'm depressed, or my anxiety is really affecting my life in a major way, you can get help, and you know, you can recover from mental illness. And I think the message is it's important to get out there, because a lot of people haven't received that message. So a service provider like Bridgeway, we're a nonprofit provider. We have very limited resources for public education, but nevertheless, we're doing what we can. We actually are, as of this week, we have television spots, 30-second spots that are going to run on various cable television shows. And it's 30-second spots with people who've used our services and who are saying, you know, you can get better. I've done it. I'm going to school. I'm working.
Well, that's been done over. There's a governor's council now on stigma.
Well,
is it still? There was a governor's council on stigma.
There was.
Stigma awareness.
There was.
No longer there.
Yeah,
Funding.
they're kind of. I think they've defunded it. I think they're still operating, but they defunded it.
Right. If you could look, I'm going to ask all of you this question. You know, the biggest change that you've seen in the past year in what you do, and if you could project a little bit, what would be the biggest change you'd like to see in the year ahead? So what's been the biggest change you've seen? And Jennifer, maybe, I know you're new in your position, so.
I am new in my position, just a couple of months, but I do know that there was plans to remove the $1 million in funding for breast cancer research in the governor's budget, and it was restored. And we're hoping that that happens again this year, that if it is taken out, that is in fact restored or at least maintained in the budget. One of the really big things that happened this year, and it hasn't come to fruition yet, but it has been passed, is the Oral Chemo Parity Act, which means that people can take chemotherapy at home orally. And for people who have transportation barriers, this is huge. And it was not allowed by some insurance companies, and so now there is parity there. It will be coming in the next few months, and that's a huge change for people.
The issue being that people maybe have an option where they can go and get a shot.
Yes, they can go and sit in a center and receive their chemo, or they can take the medication orally at home.
And that's covered by insurance,
yes.
But the oral medication is not.
It is now.
Okay.
Now with the Parity Act, it has been, and it is starting shortly. And also, there's been huge advances in research just in the last few weeks, and there has been, they've narrowed breast cancer down to 4 distinctive types, and so because of that, there's even more targeted therapies on the way, and that's been the biggest change in the last few years, and we see that coming up in the next few years as even more targeted therapies that will, and the drugs that will exist will be less invasive, and hopefully will lead to a cure in the near future.
And Dara, you're a new organization, but have you seen changes since you started?
Changes since I started.
In your patient population?
In the patient population, in certain areas, diagnosis being detected at earlier stage, so that's on a positive side, but still in other areas, it's still late stage diagnosis. So I wish that we could change that, you know, especially, you know, in the underserved areas, you know, early detection really saves lives. Becomes, you know, an ethical dilemma, it's a moral dilemma, and it's an economic dilemma. And early detection does really, you know, cover all those areas. Personally, from a personal perspective, what I would love to see is to see Cremenos grow or modeled. I mean, we are trained in patient navigation by Dr. Freeman, the Patient Navigation Institute in New York. It's a model that has worked. So from a personal perspective, I would love to see Cremenos patient navigators in the different communities in Essex County, and Hudson County, and in Morris County, to be able to get the women to get screened, early detection, and, you know, to increase our educational piece.
I think the
those
growing
communities.
use of navigators is something that everybody seems to be pointing to. Just a
Yes.
question of funding.
Yes, it's a question of funding, but traditionally, patient navigators in the state of New Jersey are in the medical communities. We need to have them more out in the communities where these women live, because a part of navigating and learning the system and the language barriers, there's also that issue of trust.
Right.
So if patient navigators are in the community and they're respected in the community, then it's a lot easier to get, you know.
To truly be community-based health
Exactly.
education.
And that's really the difference between Cremenos and other organizations or, you know, hospitals.
And Paulette, certainly you're in the neighborhoods. I mean, what changes have you seen in the past year, and what do you think the next year will hold?
Well, I know that our patient population has grown and is growing. So, you know, I would like us to be able to see if we have a patient presents himself with, say, breast cancer, or I would like to see more specialty doctors, you know, availability of more specialty doctors who will accept Medicare, Medicaid, or for the undocumented to, you know, people who will accept these patients. You know, say even a child that broke an arm, you know, more specialty docs who we can send them to, you know. So that's one of the things that we come up against all the time. That you know, you have issues, you have patients with certain medical issues that there's no specialty docs that we can send them to. You know,
So what do
you have
those
to
patients
search,
do?
and you have to search. We really have to search. That's why it's great to have collaborations with different offices, you know, and that they might, you know, we have people who will talk to them and they say, okay, we'll do this, and you know, for this patient. So you really have to have people who care. You know, like you said, patient navigators. You have to have people really who care, that they will actually search. We spend hours. I know the staff spends hours just trying to find, you know, specialty docs or whatever the
makes
patient
collaboration
needs.
so important
yes,
among
it
all
makes
the
it.
agencies.
Collaborations are extremely important. Extremely important. I mean, you know, when you think, you know, you see so many patients on a daily basis, and you see this is growing because, you know, as the unemployment gets worse, or more and more people are finding themselves in a situation where they need to come to a federally qualified health center.
So your patient load is increased
Absolutely.
exponentially.
Absolutely.
Right.
Yes.
And Cory, what's been the biggest change you've seen in the past year, and what do you foresee in the coming year?
I think from the perspective of people receiving services, the brain and the body are getting reconnected, and I think that's, I mean, that I can't understate that, because there's a big separation in the treatment world between behavioral health and the rest of health. It's really been completely separate, much to the detriment of people receiving services. But we're now starting to see, like at the Neighborhood Health Services Corporation, I know they're talking about including behavioral health specialists. At Bridgeway, on the behavioral health side, we're embedding medical professionals in our service teams. And in fact, we have a grant pending with the Neighborhood Health Services Corporation that would embed their doctors and nurses in our service teams to work with people with schizophrenia.
And what's brought about that change, do you think? I'm going to let you finish your question, but what brought about that change?
I think a lot of it comes from the federal level. This is healthcare reform that's driven by budget concerns. So there's the ACA has put money into the Centers for Medicaid and Medicare Services, and they have this innovation center. They've come up with a number of models that would improve outcomes at the same time as saving money. I think that's really the mission, not
So
just to
even-
save money, but to
improve outcomes.
Right.
So even though your patients may not say, oh, this is a result of, you know, ACA has made a difference for us, you're delivering the services, and you can say that ACA has definitely had an impact
I
already.
think it's beginning to have an impact. I think those innovations are just starting to roll out.
And what do you think you'll see in the coming year?
Well, in New Jersey, we're going to see, for behavioral health, the Medicaid program is completely separate from primary care and physical health. We're going to see a managed care company come in and take over from the state management of the Medicaid benefit. That's going to be a big change. It's going to be a big change for providers. For the patients, that remains to be seen. It all
Hopefully
depends
not
on
a
how
big
much
change.
money is going to be available for care and how effectively the innovations are going to be put into place.
Great. I think we're just about out of time. A quick last word from each of our panelists, and Jennifer, maybe just a summation here. quickly?
Sure. It's October. It's Breast Cancer Awareness Month, so it's an important time to know about breast health. And I just want to say, because this is a big push we have this year, is men can get breast cancer too. So,
Dara?
Cancer that does not discriminate. It could affect you at any point in time, so it's important to get tested and to get the word out.
Paulette?
Well, I am just glad that there's places like federally qualified health centers, that the people who need our services have a place to go at all times, and that we are there for them. So we just have to get the word out that we are here, and we are here for everyone.
And Cory, last word.
There are evidence-based practices for people suffering from mental illness. Treatment works, and there's certainly evidence-based practices for the co-occurring medical problems. So people who are dealing with that in their family or personally, they should go for help, because you can get help and you can get better.
And on that positive note, we'll end the discussion. Thank you all for being here this morning, and thank you for joining us at State of Union County 2012.